I'm Jorge Miranda. I'm a vascular surgeon at Baylor Medicine. For minimally invasive options for treatment of aneurysms, we have a plethora of options here at Baylor Medicine because the aneurysms can involve different segments of the aorta. Depending on which segments are affected, we have various treatment options. If the thoracic aorta is affected, we have what's called a TEVAR, which involves a large stent in the aorta to treat the aneurysm. When the visceral segment is involved, we have various options, such as fenestrated endovascular repairs or branched endovascular repairs to treat the aneurysms here, which involves a large stent and small stents going into each of the arteries that come off the aorta. Now, when the infrarenal segment is involved, which is right around the level of the belly button, we have what's called an EVAR, meaning it's a bifurcated device, which is a large stent in the aorta and then two small stents that go to each of the leg or the iliac arteries. Now, when the stents involve all those segments, meaning a thoracoabdominal aneurysm, then we can combine these technologies together to treat the whole aneurysm.